You spend roughly one-third of your life asleep. If you are 70 years old, you have spent over 23 years lying in bed. And during all those years, the position your body is in while you sleep has been quietly shaping your health in ways that most people never consider. Your sleep position affects your heart, your brain, your spine, your digestion, your breathing, and even how well your body clears toxic waste from your brain overnight. And after 60, when these systems are already under more strain, the position you choose matters more than it ever has. My name is Dr. Michael Williams. Let me walk you through what each sleep position is actually doing to your body and which one gives you the most protection after 60. Let us start with the position that causes the most problems: sleeping on your stomach. If you are a stomach sleeper, I understand. It feels comfortable. You have probably done it your whole life. But after 60, this position is working against you in several ways. First, your neck. To breathe while lying face down, you must turn your head to one side. That means your cervical spine is rotated for 6 to 8 hours straight. In a younger person, the muscles and ligaments recover quickly. In a senior, this prolonged rotation compresses the joints on one side of the neck, stretches the ligaments on the other, and over time contributes to chronic neck pain, stiffness, and accelerated cervical disc degeneration. Second, your lower back. Stomach sleeping lets your midsection sink into the mattress, creating an exaggerated arch in your lumbar spine. This sustained hyperextension puts pressure on the facet joints and compresses the spinal nerves, which is why many stomach sleepers wake up with lower back pain that fades during the day only to return the next morning. Third, your breathing. Lying face down compresses your chest and rib cage against the mattress, reducing the space your lungs have to expand. For seniors with any degree of lung disease, COPD, or reduced respiratory capacity, this restriction can lower oxygen levels during sleep without you ever being aware of it. If you are a stomach sleeper and you have been waking up with neck pain, back pain, or feeling unrested despite a full night of sleep, your position is very likely a major contributor. Now, let us talk about sleeping on your back. This is the position that most people assume is ideal, and for spinal alignment, it has some advantages. Your spine rests in a neutral position. Your body weight is distributed evenly. There is no rotation or lateral bending. For pure skeletal health, back sleeping has merit. But after 60, back sleeping introduces two significant problems that can outweigh those benefits. The first is sleep apnea. When you lie on your back, gravity pulls your tongue and the soft tissues at the back of your throat downward, partially or fully obstructing your airway. This is the primary mechanism of obstructive sleep apnea, and it is dramatically worse in the supine position than in any other. Studies have shown that many people who have sleep apnea only when sleeping on their back have no apnea events at all when sleeping on their side. If you snore heavily, if your partner says you stop breathing during the night, or if you wake up gasping, back sleeping is amplifying the problem. The second issue is acid reflux. When you lie flat on your back, stomach acid can travel more easily up into your esophagus because gravity is no longer helping keep it down. For seniors who take medications that relax the lower esophageal sphincter or who eat within a few hours of bedtime, back sleeping can turn mild reflux into a nightly problem that damages the esophageal lining over time and disrupts sleep quality. Now, here is where it gets interesting. Sleeping on your side is the best overall position for seniors. But which side matters more than most people realize? Sleeping on your right side is decent. It avoids the problems of stomach sleeping and back sleeping. Your airway stays open, your spine can be well aligned with proper pillow support. But there is one significant drawback. Right side sleeping can worsen acid reflux. Your stomach sits on the left side of your body, and when you lie on your right side, the junction between your esophagus and stomach is positioned in a way that allows acid to pool against the esophageal opening. Research has consistently shown that people who sleep on their right side experience more reflux episodes and longer acid exposure than those who sleep on their left. Sleeping on your left side is, for most seniors over 60, the optimal position. And here is why. Benefit number one, it is the best position for your heart. Your heart sits slightly left of center in your chest. When you sleep on your left side, gravity assists venous blood return to the heart, rather than working against it. For seniors with any degree of heart failure or cardiovascular weakness, this improved circulation efficiency during sleep can meaningfully reduce the workload on a heart that is already struggling. Cardiologists frequently recommend left-side sleeping for patients with heart failure, specifically for this reason. Benefit number two, it dramatically reduces acid reflux. When you lie on your left side, your stomach hangs naturally below the esophageal junction, and gravity keeps acid pooled in the bottom of the stomach, away from the opening. Studies show that left side sleeping reduces reflux episodes by over 70% compared to right side or back sleeping. Benefit number 3, it optimizes brain waste clearance. This is the one that most people have never heard, and it may be the most important of all. Your brain has a waste clearance system called the glymphatic system that is primarily active during sleep. Throughout the day, your brain produces metabolic waste, including a protein called beta amyloid, which is directly associated with Alzheimer's disease. During sleep, the glymphatic system flushes cerebrospinal fluid through the brain tissue, washing these waste products out and clearing them into the lymphatic system for disposal. Research published in the Journal of Neuroscience found that this glymphatic clearance is most efficient when sleeping on the side, and particularly the left side, compared to sleeping on the back or stomach. In simple terms, your brain cleans itself better when you sleep on your left side. For seniors concerned about cognitive decline and dementia, this is not a small detail. It is a nightly opportunity to support your brain's natural defense against toxic protein accumulation. Benefit number 4, it improves digestion. Your stomach and pancreas hang naturally to the left. Left side sleeping allows gravity to assist the movement of food through the stomach and into the small intestine. It also allows the pancreas to release digestive enzymes more efficiently. Seniors who experience bloating, slow digestion, or discomfort after evening meals often find that left side sleeping reduces these symptoms noticeably. Now, here is the practical question. How do you actually train yourself to sleep on your left side if you are not a natural side sleeper? First, use a body pillow. Place a full-length body pillow along your right side. This creates a physical barrier that discourages you from rolling onto your back or stomach during the night. Hugging the pillow also stabilizes your shoulder and keeps your spine aligned. Second, place a pillow between your knees. This is essential for seniors. Without a knee pillow, side sleeping allows your top leg to pull your pelvis forward, creating torsion in your lower spine. A firm pillow between the knees keeps your hips, pelvis, and lumbar spine in neutral alignment and prevents the hip and back pain that causes many people to abandon side sleeping. Third, choose the right head pillow. Side sleeping requires a thicker pillow than back sleeping because you need to fill the gap between your shoulder and your ear to keep your neck in a straight line with your spine. Too thin and your neck bends downward. Too thick and it bends upward. Either one causes neck pain and stiffness. Your pillow should keep your head perfectly level with your spine when viewed from behind. Fourth, be patient with yourself. If you have been sleeping on your back or stomach for decades, switching to left side sleeping will feel strange at first. You will roll back to your old position during the night. That is normal. It typically takes 2 to 3 weeks of consistent effort before side sleeping starts to feel natural. Start each night on your left side. If you wake up on your back, reposition. Over time, your body adapts. One important exception. If you have a specific shoulder injury, rotator cuff problem, or severe arthritis in your left shoulder, sleeping on that side may cause pain that outweighs the benefits. In that case, right side sleeping is your next best option. It still gives you the airway, spine, and partial brain clearance benefits of side sleeping, even though reflux control is not as strong. Work with your doctor to manage the shoulder issue so you can eventually transition to left side sleeping when comfortable. Let me summarize this clearly. After 60, stomach sleeping strains your neck, back, and breathing. Back sleeping worsens sleep apnea and acid reflux. Right side sleeping is good, but allows more reflux. Left side sleeping supports your heart, reduces reflux, improves brain waste clearance, and aids digestion. It is the best overall position for the aging body. You spend a third of your life in one position. Making sure that position is working for you instead of against you is one of the simplest, most impactful health changes you can make. It costs nothing, it requires no medication, and it starts tonight. If this changed how you think about something as basic as sleep, subscribe. Share this with your spouse or partner so you can both benefit. And I will see you in the next video. I am Dr. Michael Williams. Sleep on your left side tonight. Your heart, your brain, and your spine will thank you.